ADHD is actually one of the most common child mental health issues. The estimates are anywhere from 6 to 10%, and sometimes you hear estimates that are even higher than that. I think the general rule of thumb is if you look in a typical public school, you're likely to find at least one child with ADHD in every single classroom. ADHD characteristics really can affect many aspects of the classroom, so they can affect a child's academic and their learning and the educational style that they need in the classroom. It can affect them behaviorally in terms of how they regulate their behavior in the classroom, how they're able to sit, how they're able to respond to the teacher's rules and guidelines, and it also can affect socially, how well they are at taking in and interpreting social cues and responding to social situations. For some students, the teacher is going to be the one that spots it, and teachers can be very good detectors of when ADHD symptoms are getting in the child's way of being successful at school. For some students, the difficulties are going to be more apparent at home, and I think what parents want to attend to is, are symptoms like having trouble paying attention, being impulsive, being restless, getting in the way of what a child's supposed to be doing at their own age? So I think if that's happening, it's important for a parent to talk to the child's school, to talk to the child's pediatrician, and go from there. Interventions to help students with ADHD tend to take a couple forms. One is changing the environment, so we're placing the right kind of demands that students can respond to. Two is changing how information is presented or taught. And three is doing skill teaching to help the child learn either skills they have not learned on their own or supports for things that are more challenging for them than they might be for another child their age. Children with ADHD are just sort of at the extremes of characteristics that all people have, and that makes certain situations difficult. If you have a hard time, taking in information presented orally and you have to sit in a middle school classroom where the teacher's going to lecture for 20 minutes, that's just a mismatch. And so helping a child there is just changing the environment so the material is presented in a way that works for them.